Next thing what
Yes,
we
sir.
should discuss, please comment.
Sir, Thorax.
Thorax. Thorax, there is nothing much to discuss. Only we are having heart and lungs.
Mhm.
Yeah, heart and lungs. So most commonly made mistake that I have noticed is telling the base of the heart. So the thing that we are putting on the palm, that is the inferior surface of the diaphragmatic surface. It is not the base. Okay, it is called as diaphragmatic surface, and the posterior
Yes,
surface, which is formed by the left atrium and part of the right
yes, sir.
atrium, it is called as the base of the heart. So one
Yes.
should not confuse between the
Base of
diaphragmatic
the heart and
surface and base
diaphragmatic
of the heart.
muscle.
Okay, so this is a
Yes,
very
sir.
important question. Another thing is while holding the heart in anatomical position, you should clearly point the apex towards the left, forwards, and laterally. You should not point the apex just forwards, so that all the structures they go in wrong place. So if you put the apex towards the left, forwards, and laterally, all other structures automatically they come in place. The arch of aorta, it will go from anterior to posterior and slightly towards the left. So आर्च ऑफ एओर्टा की डायरेक्शन भी अपने आप पोजीशन में आ जाती है. एपेक्स अच्छे
Mhm.
से आप लेफ्ट को फॉरवर्ड और लैटरली
Mhm.
पकड़ते हो तो ठीक है. तो इससे आपको राइट एट्रियम और राइट वेंट्रिकल पहचानने में दिक्कत नहीं जाती. राइट वेंट्रिकल की
Mhm.
जो टर्मिनोलॉजीज है वो आपको पक्की करनी है. राइट एट्रियम तो सब लोग करते ही है. राइट एट्रियम में हमें पता
Yes.
है कि वो फोसा ओवेलिस, लिम्बस फोसा ओवेलिस, ओपनिंग ऑफ द कोरोनरी साइनस, ये चीजें दिखती है. फिर मस्कुलर
Mhm.
पेक्टिनेटी, क्रिस्टा टर्मिनालिस, सल्कस टर्मिनालिस
Yes.
ऑन द एक्सटर्नल एस्पेक्ट, ये सारी चीजें हमें पता है. लेकिन
Mhm.
राइट वेंट्रिकल में हम भूल जाते हैं कि देर आर कॉर्डी टेंडेनी, देर आर
Mhm.
ट्रेबिकुले कार्नी, देर आर रीजेस, ब्रिजेस एंड पिलर्स. ठीक है. सो
Yes, sir.
एग्जाम्पल ऑफ ब्रिजेस एंड एग्जाम्पल ऑफ पिलर्स. सो दीज आर द इम्पोर्टेंट क्वेश्चन वन शुड रीड एंड रिवाइज. ठीक है. सो
Mhm.
मॉडरेटर बैंड, इट इज एग्जाम्पल ऑफ अ ब्रिज. ठीक है. सुप्रावेंट्रिकुलर क्रेस्ट, इट इज एग्जाम्पल ऑफ अ रिज. ठीक है. एंड पिलर्स, these are the papillary muscles. These
Yes.
are pillars. So
That will.
prepare the right ventricle. If anyone gets right ventricle, then most commonly unanswered question or most commonly wrongly answered question, it is about the coronary arteries. The student failed to answer coronary arteries are branches of. Coronary arteries are branches of ascending
Uh,
aorta. ठीक है. Most of the students answer this question as coronary arteries are branches of sinus, and when telling the sinus they land up in coronary sinus, whereas it is not the coronary sinus
whenever.
but it is aortic sinus of the ascending
Sinus.
aorta. ठीक है. So
Yes, sir.
anterior aortic sinus and left posterior aortic sinus. So remember
Mhm.
and note down, these are aortic sinuses of ascending aorta. These are aortic
Aortic
sinuses
sinus.
of ascending aorta. ठीक है.
And aorta.
Coronary
Yes,
sinus
sir.
is vein draining the heart. ठीक है. Coronary sinus is a venous drainage of the heart. So please do not tell the coronary arteries they arise from the coronary sinus. These are arising from aortic
Ascending aorta.
sinuses of ascending aorta. So this is very
Aorta.
important question. ठीक है. And then you should remember the branches of arch of aorta also. Then its beginning and termination. So arch of aorta begins at the level of and ends at the level of the sternal angle. ठीक है.
Sir.
So you can expect a question on the what are the various changes taking place at the level of sternal angle. I hope it has been asked in the university exam also.
Yes, sir. There
Yes.
also.
Yes. Next, we are having lungs. Lungs. In lungs, surprisingly, I was taking sessional exam in my college, and the students were
Yes.
not able to tell pulmonary arteries are branches of. Okay, the batch 2022 students, they were not able to answer pulmonary arteries are branches of, they get confused due to the pressure of exam, they get confused. So pulmonary arteries, these are branches of pulmonary trunk, which is arising from right ventricle. So this is a very, very basic question, but I don't know why students, they get under pressure and they are not able to answer these basic questions. So pulmonary trunk, it gives rise to pulmonary aorta. The pulmonary aorta, the pulmonary arteries, and the pulmonary arteries, they carry deoxygenated blood. तो इतना बेसिक तक पूछते हैं, बहुत बेसिक. सो मैं किसी कॉलेज में जाता हूँ तो मैं तो सबसे पहले ब्लड कैसे सर्कुलेट होता है बॉडी में, यही से शुरू करता हूँ. वही से मुझे पता चलता है कि स्टूडेंट को पता है कि नहीं पता है. ठीक है, तो इतना बेसिक करके रखना बहुत ज्यादा बेसिक है ना. दूसरी बात है सुपीरियर वेना के बाद, जब सुपीरियर वेना के बाद पूछते हैं तो यू bound to get a question about formation of superior vena cava. So superior vena cava, it is formed by right brachiocephalic and left brachiocephalic vein. Next question you will get, which one is longer? So obviously the left one, it has to travel towards the right side, so it will be longer and it will be crossing all the major branches of arch of aorta. The three branches, it will be crossed anteriorly by the left brachiocephalic vein. So these are important relations one should remember. Then about the lungs, lung specimen, prepare bronchopulmonary segment, definition of bronchopulmonary segment. Most of the students will get these questions on the lung. What is a bronchopulmonary segment? So you should be able to tell the complete definition. Complete definition, that is, it is a anatomical and functional unit of the lung, which is well aerated by segmental bronchus, which is well aerated by segmental bronchus. Okay. So you should be able to tell the complete definition. Okay. Then about the site determination and various features of the lung, most of the students will tell the mediastinal surface of right lung and left lung without fail. Just remember, whenever you are holding the lungs, hold the anterior border anteriorly. Most of the students tend to hold it like this. The anterior border, it goes medially, and the medial surface, it goes posteriorly. So entire lung anatomical position, it goes wrong. So the thin anterior border, it should be always held anteriorly, so that the medial surface or the mediastinal surface, it is facing medially. So whatever surfaces and borders we are going to tell, they should be actually seen to the examiner in that way. So if you are describing anterior border, it should be seen anteriorly. If you are describing posterior border, it should be seen posteriorly. Okay. So after determining the site, next question the students mostly go wrong, it is the cardiac notch. So I have seen the ventricular impression, the area related to the left ventricle, it has been shown as cardiac notch. Most of the students, the colleges, the students keep on telling the impression, that is the area which is related to the left ventricle, it is cardiac notch. It is wrong. Along the anterior border, there is a depression. Along the anterior border, there is a depression which is called as cardiac notch. And at the lower end of this cardiac notch, there is lingula. At the lower end of this cardiac notch, there is lingula. So these are the important questions. Then next question you tend to get, it is the blood supply of the lungs. Whenever we discuss the blood supply of the lungs, it is the blood which is going for oxygenation and deoxygenation, and the blood which is taking care of the parenchyma of the lung parenchyma. Okay. So lung parenchyma is taken care by bronchial vessels, bronchial artery and bronchial vein. Okay. And these, for the oxygenation and deoxygenation, we are having pulmonary artery and pulmonary veins. Okay. So in the bronchopulmonary segments, we are having intersegmental veins. So the question asked is, what are these intersegmental veins? Whether these are bronchial or pulmonary. So these are pulmonary veins. Okay. So intersegmental venules, these are pulmonary venules. Okay. So Another important thing which most of the students know, but some students don't know, that is how to differentiate between different structures in the root of the hilum, okay, by their relations.
Yes,
On the right side, bronchus artery, bronchus vein. On the left side, there is artery, bronchus, and vein. If asked about the bronchus particularly, the bronchus, it shows presence of hyaline cartilage. So it is hard. So always feel the structures. Any muscle you have to feel end to end, trace its origin, insertion. Any structure you have to feel not by the forceps but with your fingers. Okay. Then and then only you will be able to differentiate between blood vessel and nerves and these cartilages.